Well, February is not only American Heart Month, a time to get people focused on their cardiovascular health, but it's also Gum Disease Awareness Month. Now, many people don't actually realize how the health of your gums is closely connected to your heart health. Well, joining me now is Dr. Carey of Birdie Dental Group. So first off, thank you for being here this morning.
Appreciate you having me on.
Yeah, I'm really excited to talk about this because I feel like a lot of people don't really know why our mouth health is such a vital part of our health. So tell us a little bit about that.
You're absolutely right. A lot of people don't realize how important the gums are in relation to your oral health. Many people, when they're doing their oral hygiene routine, focus on their teeth, which is obviously important, but kind of skip over their gums and how important they are to having a healthy mouth. The gums really act as a support for the teeth. So you got to have healthy gum tissue in order to have healthy teeth, much like with a house. You have to have a great foundation for your house, otherwise you'll have problems down the road. So the mouth is the same way. Having healthy gums really plays a key role in having a healthy mouth, but also a healthy body as well.
So tell us how the gum health is directly connected to your heart health.
So many people didn't realize, but there's about 4 in 10 Americans are affected by gum disease in some way. And a lot of studies have actually shown that some of the bacteria from gum disease can get into your bloodstream, can cause inflammation in the heart, and can even potentially cause infection in the heart valves themselves. Basically, your body is having to fight off this infection and inflammation in your mouth, which can spread to other areas of the body, such as heart, which is really, really key. Also, some other systemic diseases, such as diabetes, are highly linked to gum disease. So having healthy gums really has an effect on your overall body health.
And how is gum disease treated?
So we have a couple ways that we treat it, and it really depends on how early it's caught, what stage it's caught, which is why it's really, really important to have preventative care with your dentist and your dental hygienist, because we're always looking for signs of gum disease. If it's early stage, we can treat it in a non-surgical approach. Many people have heard of a deep cleaning, which basically means we go below the gum line, cleaning off the bacteria that is accumulated on the root surfaces of the teeth. It's really removal of the bacteria that is the key. You can never fully get rid of gum disease, so it's an ongoing, lifelong process of maintenance afterwards, coming in for several maintenance appointments throughout the year so we can keep the disease at bay. You never fully get rid of the bacteria, but the whole goal is minimizing them every day through your care at home and also the professional care that you get with your dentist. If it's a later stage disease, you have a much lower prognosis, but it's really important to get treated if you want to have a hope of saving your teeth. At Birdie Dental Group, we have a process called LANAP, where we treat the gums with a laser. So instead of traditional gum surgery with a knife, we use a laser to treat the diseased tissue, which is much less painful for the patients. You have a much faster recovery and a great overall experience, and as good of, if not better, results than you would with traditional gum treatments.
And is there any way to prevent gum disease? Does that come with cleaning properly? Because a lot of people don't know how to properly clean their gums as well.
Sure. So early stage gum disease, and so you may have heard of gingivitis, where the gums become irritated and bleeding. Yeah, it's not normal for your gums to bleed. Just like if you were to wash your hands and your fingernails started bleeding, you think, oh my gosh, this isn't normal. That's what you need to be thinking about when you're brushing and flossing your teeth. So really, prevention is the key. Doing a great job at home and then coming in for your regular checkups. At Birdie Dental Group, we really want you to make sure that you're coming in at least twice a year for your checkups. Just because you're healthy at one point doesn't mean your body's going to change down the road. So really spending the time in preventative care, what you do at home with some of the great tools that you have to clean your mouth. We all know about flossing and brushing, spending the quality time. Some things you may not have heard of before are rubber tip stimulator. This little rubber point, actually you take it at the gum and massage the gum tissue to help stimulate blood flow, to help break up plaque, and also cleaning your tongue with a tongue scraper like that helps remove debris, plaque, and bacteria from your tongue, which a lot of people forget about. And really the key is getting rid of the bacteria every single day, multiple times throughout the day, to help prevent gum disease and to have a great oral health and also a healthy body along with that.
Absolutely. And it's also important to make sure you're cleaning your gums, right? Like brushing upwards towards your gum line. And
absolutely. Paying special attention. Again, it's not just the time, but the quality of how you're brushing, doing it properly. And that's what we really strive to do in our practice, is not just polishing your teeth and cleaning your teeth when you're there, but our hygienists and doctors both spend a lot of time making sure that you know how to do it properly, not that you're just spending 30 seconds and going real quick and thinking you did a good job. And we have to give you feedback. Hey, you're doing an excellent job, or hey, you need some help in these areas. And we want to reinforce and stress and educate you on how to do it properly because we want you to be a healthy patient.
Absolutely. And we are running out of time, but I did want to ask, is it true that you should be brushing your teeth for at least 2 minutes?
Absolutely, at least 2 to 3 minutes. And again,
Wow.
the time is important, and one of the nice things with electric toothbrushes is they have built-in timers often, so it helps you realize because it's a lot longer than you typically think it is.
Yeah, 2 to 3 minutes can be super long. So thank you so much, Dr. Carey. It was a pleasure having you on this morning.
Thank you for having me.